Over 2 years ago, my orthopedic surgeon told me I was going to need knee replacement surgery. Well, you clicked on this video because that did not happen. I found BPC-157. I'm Jake Watkins, and this is my channel where I talk about what I call a high-tech lifestyle. It's where I'm going to talk about software development, AI, biohacking, fitness, whatever comes to mind. And what could be more high-tech than injecting yourself with research-grade chemicals, right? So what led me to using BPC-157? So it starts off with doing a workout. We're doing sprints, and I injured my knee. I didn't know it at the time, but the next day I was limping, and it just got worse and worse, and knee swelled up size of a cantaloupe. So finally went to a doctor. They x-rayed. They said they didn't see any damage, but they sent me off to an MRI. The MRI came back, said I had a torn meniscus. Off to an orthopedic surgeon who described it as a shark attack. And he said, basically, I was going to need knee replacement surgery. Well, not wild about that answer. So, of course, I did what I always do. I started digging in, and turns out 50% of the population probably has a torn meniscus, just so you know. Time went by, I found out about gel injections. So me and the ortho started doing that about once a year. And in my case, it worked great. Some people get them like every 6 to 10 weeks, which those people generally end up having surgery. But I'm lucky. Seems that I was okay with the gel injections. Then I'm sitting there working out one day, and I hear the Huberman Lab podcast, and he's talking about peptides, and BPC-157 and TB500 came up and sounded great. So I started digging into it and learning everything I could about BPC-157. I was on PubMed, Reddit forums. Yeah, I read that stuff. Watching YouTube videos. I basically, if I could read it, listen to it, or watch it, I did everything I could. And honestly, from what I saw, sounded good. Not a lot of human data. All of the human stuff is generally anecdotal, which, yeah, my cousin's best friend's girlfriend once injected BPC-157 and she got bubonic plague type stuff, right? So got to take it with a grain of salt. But the animal studies look good. So I did what an intelligent person would do. I went and talked to a doctor. So we've got nearby the Cell Spa. These guys, that's what they do, peptides. Not affiliated with them, but they just happen to be nearby. And worked with a good doctor. Asked him all the questions, and he pretty much said, use the BPC-157 in my situation. So things like cartilage, joints, tendons, ligaments, stuff like that is where BPC-157 really seems to shine. The TB500 is like, yeah, when we do stem cells, and I like the confidence of when we do it, we'll use the TB500 to accelerate the healing. I haven't dug into TB500 as much, not using it. But basically, my assessment is if you have a wound, post-surgery, stuff like that, it seems to me that's where you really use it. People who are constantly jabbing both, it's not my experience. I guess I'll try to avoid commenting, but I'd say just stick with BPC-157 or what your doctor tells you to do. There's an idea. Anyway, so he got me on to BPC-157 from their compounding pharmacy. Worked great. So fast forward a couple of months and a few vials of BPC-157. Things are going great, but along the way, I'm seeing a lot of places, a lot of people are getting their peptides from these research use only places. And I'm like, well, and everybody warns you against, oh my goodness, they're getting them from China. Oh my God. Well, your freaking iPhone's from China. So anyway, so I decided, just after looking at everything, why not? I mean, the compounding pharmacy is absolutely gold standard. If you can afford from a compounding pharmacy, get it from there. Don't even bother. At least if they're a good compounding pharmacy. I've been lucky. The two places that I've gotten my peptides from have been rock solid. As a matter of fact, one of them actually came up, and can't remember his name right now. But anyway, his video, and he happened to mention the place I got. He was talking about retatrutide, but he tested them and they came back good. Anyway, long story, rabbit hole, sorry. Started getting from a research use only place, and that's what I've been using. And at $60, it's pretty cheap, and the results have been good. So I've been using BPC-157 since July of 2024, about the time I posted the first video here about it. And I've been fairly consistently using the stuff. Well, I'll cycle on and off. I don't think you actually have to. It's just jabbing yourself all the time does get old. But the results, that's why you're here, the results. My knee feels fine. This year, my goal is to finally, I've been up to 365 pounds for a back squat. It was good, and life happened and all like that. So we're going to build up. We're going to hit 405 this year. We're in January. We'll hit 405 this year. And I'm going to get a 585 deadlift as well. So that's what we're talking about. I'm going to, there's a lot of plates spinning, but I'm like, I'm going to start running at my CrossFit workouts. But that's what BPC-157 has done for me. In addition to my knee feeling better, in general, everything has felt better. And in addition to like the whole joint, ligament, and stuff like that, I notice when I take BPC-157, I sleep better. My stomach, I have a pretty good digestive tract, but you know, everybody has tummy issues. I don't have tummy issues while I'm taking BPC-157, which I would say actually makes a lot of sense given what BPC-157 is. It is a gastric. It's a peptide that is in your GI tract that they're just extracting and you're putting in other places. So there's additional benefits to taking it besides just healing your joints and all. So my complaints with BPC-157, probably the biggest complaint I have, and I bring up in all of my other videos about BPC, the amount of clinical data we have. There are no double-blind human control trials or any of that stuff that we can point to know what's going on. Is it really healing my cartilage? Is it, what's it doing? I don't know. I know I feel better, but what exactly is going on? Don't know. But I'll take it. Other complaint. It's not such a complaint. And it is related to the whole clinical thing. How much should you use? I see dosages all over the place. Me personally, I shoot 1 milligram 3 times a week, maybe, when I'm shooting. Right now, this week I only used 1 milligram the whole week, and I'll shoot again tonight. So it's all over the place, and you're going to get different recommendations. This is another reason to work with a doctor. Also, I weigh 215 pounds now. If you weigh, say, 300 pounds, is 1 milligram the same for you as it is for me? Don't know. And again, clinical data would be great. Site injection. You see a lot of people talk about doing site injection. Unless you're using a super long needle, you're shooting into subcutaneous tissue. It gets distributed everywhere anyway. So if you need to do your shoulder, I mean, you can just shoot in your abdomen. You know, if it's your back, you don't, oh God, I couldn't imagine. I have a friend who has a back injury who is using BPC. Anyway, again, rabbit hole. Sorry about that. Anyway, so those are kind of my complaints. The lack of clinical data, lack of dosing information, and guidance, which means you really do need to talk to a doctor to help you set things up. So what am I doing now? Well, I am going to warn you, if you're not already doing peptides, BPC-157 is a gateway drug. I remember in high school when they gave you those drug talks and they talked about marijuana as a gateway drug and it'll lead you to doing PCP and all these other things. BPC really is a gateway drug. Oh my God. If it works for you, you'll be like, oh my God, I feel so much better. What about all these other peptides? What can they do for me? Funny thing, the GLP-1s, those are peptides. Retatrutide, semaglutide, tirzepatide, all peptides. Ipamorelin, CJC, on and on and on. There's so many peptides. Copper peptide for your hair and make your skin better. So be warned. It'll get you started. So it should go without saying, this is my experience. It's not medical advice. But what should you do? I would suggest follow in my footsteps, actually. Go read everything you can. Get on PubMed, search for BPC-157. Google it. Talk to Copilot or Gemini or whichever AI pet you like best. Get as much information, educate yourself. Then go talk to a doctor who specializes in peptides. Cell Spa is a good place. They do video visits. I think they'll even talk to you if you're outside of Texas. Point is, educate yourself. Don't just go because some random redneck on the internet said, oh, BPC is great. Okay, don't do that. Educate yourself. Know what you're getting into. Then take your time. Make sure you're getting from a good supplier. I recommend start from your doctor's compounding pharmacy so that you'll know what a good BPC-157 is like. Because if you get it from a place on the internet, it'll probably be all right. How do you know? People who come back say, oh, it didn't work for me. Well, it's hard to say. Did you get it from a good place? That's the problem. So start with the compounding pharmacy your doctor prescribes from. So you want to know what I'm up to now. Well, I'm coming off of retatrutide. I've been using it since August of 25, and I hit my goal weight, and I'm coming off. So this video is talking about my experience and what I think you should do if you're going to get onto a GLP-1. I say GLP-1 because they're all GLP-1s, whether it's tirzepatide, retatrutide, or semaglutide. They all have GLP-1 in them. So that's my point there. And this video is whatever the algorithm thinks you'd like to watch from me, which the algorithm doesn't like me, so no promises. Anyway, I appreciate you watching this far. I hope you'll watch more of my videos and subscribe. Got questions? I'm always happy to chat with people, trying to build a community. So you have a good evening, and I'll see you around.